Hi, my name is Jennifer Reft. I'm an instructor in the Physical Therapy Assistant Program at Morton College in Cicero, Illinois. This video is specifically for my students who are taking 212, and the text that I'm referencing is Neurological Interventions for Physical Therapy by Martin and Kessler. So I'm going to talk about the D1 diagonals. There's a D1 flexion, a D2 flexion, a D1 extension, and a D2 extension for both the upper extremity and lower extremity. So there's a total of 4 patterns for each upper extremity and lower extremity. I'm going to do the upper extremity first. The most important thing to remember is when you're studying the PNF diagonals, learn the movements in your body first. Do them all the time, and then go back and check your components. Do the movements first. Learn the movements in your body, and then you can always figure them out. So I'm going to demonstrate the D1 flexion pattern first, and when I demonstrate the patterns, I'm going to talk about them more in a general term, the way you might talk to them with a patient or a lay person, and then go back and identify the individual components. So to perform D1 flexion, you're actually going to start from the D1 extension position. Arm is out and away, wrist extended, hand is open, and kind of cocked towards the ulnar side. You're going to make a fist and pull the entire upper extremity up and over in front of you. Again, D1 flexion, you're going to start the arm out and away, extended, hand out, cocked towards the ulnar side, make a fist, up and in front of you. On the other side, same thing, arm out and away, extended, hand is open, cocked towards the ulnar side. To perform D1 flexion for the upper extremity, make a fist, bring it towards the radial side, arm comes up and over. So what are the components of D1 flexion? When you're performing D1 flexion, at the shoulder, you're going to do flexion, adduction, and external rotation. Again, for D1 flexion, it's going to be flexion, adduction, and external rotation. Okay? For D1 extension, you're going to start from the fully flexed position. So arm in front, in a fist, kind of cocked towards the thumb side or the radial side. You're going to pull down and out and away, finishing with your hand open, cocked towards the ulnar side. Again, for D1 extension, you're going to start in the ending position for D1 flexion. So arm is in front, in a fist, cocked towards the radial side. You're going to pull down, out, and away. Okay? For D1 extension, the components are going to be extension, abduction, and internal rotation. Okay, at the hand, you're going to go from a fist position, cocked towards the radial side, towards an open hand position, extended, cocked towards the ulnar side. The elbow is generally kept straight, but it may be bent. The elbow can kind of go either way. So summing up, for D1 flexion, you're going to start from the extended position. Arm is out and away, wrist is extended, fingers are out, cocked towards the ulnar side. You're going to make a fist, cock your wrist towards the radial side, pull your shoulder into flexion, adduction, and external rotation. And notice the forearm goes from pronation to supination. Again, for D1 flexion, you're going to start in that fully extended position. You're going to make a fist, cock it towards the radial side, flex your shoulder, adduct your shoulder, and externally rotate. And you'll also go from pronation to supination at the forearm. And that also can be done bilaterally, just like that. For D1 extension, you're going to start from the fully flexed position. So arm is going to be up in front of you in a fist towards the radial, cocked towards the radial side. To perform D1 extension, you're going to release your hand, cock it towards the ulnar side, extend, abduct, and internally rotate. Again, for D1 extension, you're going to start from a flexed, adducted, externally rotated position. You're gonna open up your hand, bring it down and out and away, performing extension, abduction, and internal rotation. And that's D1 flexion and D1 extension for the upper extremity. For D2 flexion, you're going to start from the ending position for D2 extension. Arm is going to be across your body in a fist, cocked towards the ulnar side. This pattern is frequently called taking your sword out of your scabbard. So you're going to take your sword out of your scabbard and you're going to throw it away. Okay, so for D1 flexion, arm close to your body, cocked towards the ulnar side, and you're going to throw your sword away. So what are the components of that motion? You're going to start in the D2 extension, pattern, and you're going to release your hand while you bring it towards the radial side. You're going to flex, abduct, and externally rotate. Okay, this is for D2 flexion. So again, you're going to start with the arm in close, in a fist, kind of cocked towards the ulnar side. To perform D2 flexion, you're going to release your hand, cock it towards the radial side, flex, abduct, and externally rotate. And that's D2 flexion. D2 extension will start from the flex position. So arm is out and away, hand is open, cocked towards the radial side. To perform D1 extension, you're going to cock your hand towards the ulnar side while you make a fist. You're going to extend, abduct, and internally rotate. Again, for the D1 extension pattern, you're going to start with your arm out and away, fist is open, cock towards the radial side. You're going to make a fist, cock it towards the ulnar side. You're going to extend, abduct, and internally rotate. And then your arm is also going to go from supination to pronation at the forearm. And that is D2 extension. Also can be done bilaterally. So either going across like that, or coming out here and coming back in. And those are the D1 and D2 diagonal patterns for PNF.